The second issue that I wanted to raise today, after discussions with Dr. Romero, we are seeing a need for making the booster shot more available. And so let's go to the first graph, and you'll see that this is the current recommendations of CDC in reference to our booster shots. For Pfizer, Moderna, those who are 65 years and older are eligible for the, are recommended for the booster. If you're 18 and over, then you have to be in a long-term care setting, have underlying health conditions, or working in a high-risk setting. And it should be 6 months after the second shot. For the Johnson & Johnson, it's the same if you're 18 over, but theirs is 2 months after the first shot. That is the current recommendations of CDC, and what we're finding is that we want more people to get their booster shot, and that this is somewhat confusing and limiting as to the eligibility of those that ought to be getting their booster shot. And so in consultation with the Department of Health, we're changing that to go to the next slide, and this is the recommendations and the policy of our state of Arkansas through our Department of Health. For Pfizer and Moderna, those who are 18 and over, go get the shot. There's not any limitations on that. Obviously, you should be 6 months after the second shot, but we want you to get the booster because, as the data indicates, that the effectiveness of the vaccine deteriorates over time, and so that's the reason for the booster. And we want to make sure everybody that's 18 and over is eligible and is encouraged to get the booster. And the same Johnson & Johnson, of course, that's 2 months after the first shot. Go get your booster if you are 18 and over. So this is a change in policy that we're implementing here in Arkansas. I think it'll eliminate some confusion, and it'll also encourage everyone across the board that meets this criteria to go get the booster shot. That's the best protection from the virus and from serious health consequences.